Welcome to USHempTV. I'm Jonathan Miller, the General Counsel for the US Hemp Roundtable, and I'm really honored to be joined today by Michael McGuffin, who has been for the last 22 years, the president of the American Herbal Products Association, or AHPA, leading the Dietary Supplement Trade Association. Michael, welcome to USHempTV.
Thank you very much, Jonathan. I appreciate the opportunity, and it's as is always the case with CBD, a hot topic, isn't it?
Yeah, so CBD and other hemp extracts are one of many thousands of botanicals that you work on every day, but it's become perhaps one of the most popular. And now, as we are trying to promote full legalization and full regulation of CBD as a dietary supplement, it's important for our viewers to really understand what is the regulations and the laws concerning dietary supplements. And this became even more important a few weeks ago when two CBD companies, Charlotte's Web and Irwin Naturals, got rejected by the FDA for their applications for new dietary ingredient notifications, NDINs. So let's cut through the alphabet, and can you explain to our folks what an NDIN means?
Sure. Food, Drug, and Cosmetic Act was amended in 1994 with the passage of the Dietary Supplement Health and Education Act. Among the many features of that bill was a recognition that ingredients currently in the marketplace could assumed to be safe. We weren't going to have to go produce new safety evidence on chamomile and echinacea and vitamin C, but any new ingredients that came to the marketplace would have to go through a process of a notification to the Food and Drug Administration of the conclusions drawn by that marketer that the new ingredient will be reasonably expected to be safe under the conditions of use intended for the ingredient. So in this case, the conditions of use of a full spectrum hemp extract, in these two cases, a full spectrum hemp extract in the form of a dietary supplement at various levels of CBD included in the full spectrum hemp extract. And both of these companies submitted pretty extensive new dietary ingredient notifications that FDA then reviews. And they don't actually reject. That's not the word that they use. They either acknowledge the receipt, which is a nice 2-page letter. Thank you very much. Here are the requirements. We're filing this. Or they provide a discourse on the subject of the new dietary ingredient notification, where they identify what they refer to as significant concerns about the information submitted.
So the significant concerns that the FDA in this case were twofold. One was legal, and another was more on safety. If you could kind of go through those.
FDA has been stating very clearly since 2014, or possibly even earlier, their position that their interpretation of the statutory provision on prior drug approval or prior drug investigation is a restriction against the use of the same article in a dietary supplement. So there's really no surprise that in responding to these NDINs, FDA restated that. At the same time, could we be a little disappointed? Yeah, we're looking for FDA to move forward in establishing a clear regulatory framework. We've been in this regulatory gray zone, approaching the 3-year anniversary of the enactment of the 2018 Farm Bill. Look, Jonathan, you and I both are very clear, as are the marketers of CBD and all hemp products, that the congressional intent was to support farmers and consumers by establishing a lawful process for the production and use of hemp and products derived from hemp. And FDA has this legal position. So we could agree or disagree with the legal position. The agency also has the authority to overcome this by initiating a regulatory process, and they haven't done that. So yes, disappointing, not surprising that they wouldn't do that in response to these 2 letters. Again, you and I know, we were talking about this just before we started recording here, there are several bills now pending in the United States Congress. If we need to rely on the Congress to break the the log jam here, the resistance, then we'll do that. But it is, again, not surprising and somewhat disappointing that FDA didn't say, here's the opportunity to institute the process of creating a lawful pathway. When it came to the substance of it, this should have looked very familiar to anybody that has reviewed prior new dietary ingredient notifications. The agency used very similar language. That's the term they use, significant concerns. And they identified, again, some topics that we've heard about before. We've heard FDA discuss their view that there needs to be addressed concerns that have been raised about hepatotoxicity, reproductive toxicity. They repeated that here. And I think there are over about 1,100 of these NDINs that have been submitted to FDA over the last 27 years now. And we have to look at them all. It's just our job to pay attention and see what the lessons are, what the learning can be from each of them. We actually created a NDI database that we make available online so that others can look at and review these. It's simply not a surprise to see FDA identify these concerns, but then what they always do is they essentially lay out a roadmap. If you want to resubmit, you're going to have to address, again, in these two letters, the hepatotoxicity and reproductive toxicity concerns that have been identified. And this isn't an opportunity to say, oh, come on, why are you worried about those? It really is a challenge to these two companies. Address those issues. Tell the agency how your ingredient can be reasonably expected to be safe with regard to those concerns raised by FDA.
So you spoke earlier about our legislation that we've been excitedly supporting. In the House, it's HR 841, and in the Senate, it's 1698. Go to regulatecbdnow.com to let your members of Congress know how strongly you feel about this. But both of those allow for CBD and other hemp extracts to use all available pathways to demonstrate safety in a safety evaluation, not just NDINs, but others as well. Can you explain the different pathways that companies can use currently for dietary supplements?
Sure, and I appreciate your use of the word pathway. The word that I tend to use is statutory option. Critics call it a loophole. It's not actually a loophole. The statute clearly states that an ingredient that is a new dietary ingredient can either utilize the NDIN pathway, which we just described, or a GRAS pathway, GRAS being generally recognized as safe. But that's limited only to articles that have a prior use as food. So a perfect example in our world of hemp products is that hemp seed oil has been the subject of a formal notification to FDA, a formal submission to FDA of a GRAS dossier, to which FDA responded with what's referred to as a no questions letter. FDA looked at that really good data that was submitted, said we have no questions about your conclusion that this food will be reasonably expected to be safe. And so we should be able to rely on that GRAS notification. If I wanted to take that hemp seed oil, put it in a capsule, sell it as a dietary supplement, the safety work has already been done. That's just an example. It's possible that there are other hemp-derived ingredients that are also in the food supply for which there is a determination through the GRAS process, which need not be necessarily submitted to the Food and Drug Administration. You can also rely on what's called self-affirmed GRAS. And I guess it's at the same time that we think we have to protect that. We have to protect that other avenue, that other pathway. It's not difficult to understand the concerns of our critics that self-affirmed GRAS is not sufficiently transparent. That's not a discussion that started with hemp, believe me. This is the food safety people, the consumer activist people have been pushing back against the use of self-determination of GRAS for quite a long time, but that's the law of the land today. We're allowed to use that today. And unless somebody's going to revise that, we should be allowed to use it for our ingredients also.
So, to put an exclamation point on this, the FDA has responded to the legislation that we referred to and has recommended that Congress amend it and only allow CBD, not even other hemp extracts, but only allow CBD to use the NDIN pathway statutory authorization, however you want to put it, and not allow the use of self-affirmed grass. AHPA is part of this coalition that we've developed to advocate for these bills, has been very strongly and passionate about allowing all of these different statutory authorizations, pathways, however we want to put it. Can you explain why you feel so strongly about that?
Well, there are a couple of reasons. One is it is the regulation today, and we are always going to be resistant to special regulations to one ingredient. And so this is the regulation that ought to work for this ingredient. The other is that we're concerned that to say that that doesn't work for this ingredient undermines the whole basis, doesn't it? If you can't make a determination of safety for a hemp extract, a full spectrum hemp extract under the allowed mechanism for any other naturally derived ingredient, then it seems to suggest that that self-affirmation of grass doesn't work for anything. And that is far too big a change without a much more in-depth discussion. If we're going to move away from self-affirmed grass, that can't be only about cannabis, sativa, and the hemp cultivars therefrom and the ingredients made from that. So we want to protect it because that's what is expected for all ingredients. And we think it's really a bad idea for hemp and hemp extracts to be treated differently than other ingredients.
Yeah, and the US Hemp Roundtable Board of Directors agrees with that position, and also will add that a NDIN only path would be very, very difficult and onerous for smaller mid-sized companies in this space. We of course want to make sure the science is there and the safety is there, but the self-affirmed grass pathway offers that provision and provides for the kind of safety evaluations and checks and balances that we want to have for ingestible products. Is that something that you agree with as well?
Yes, it is, and it's important to understand it's not a lesser safety standard. It's the same safety standard. You still have to arrive at a conclusion where there's an expectation that consumers that eat this ingredient are not going to be harmed. You know, there's slightly different language, regulatory language, but you don't, it's not like one of them you do a Google search and one of them you do all kinds of research with, 15-day studies and 60-day studies and establish a NOEL and all of that. No. They're both very serious safety standards. And anybody that thinks it's a shortcut is misunderstanding. It's a high standard, which is what we want. We really want to be selling safe ingredients, and we want there to be a regulatory process that works in support of selling safe ingredients.
Michael McGuffin, president of the American Herbal Products Association, thanks for joining us, but more importantly, thanks for your leadership on these issues as we work arm in arm to fight for the hemp industry, farmers, and for small and medium-sized manufacturers as well. Thanks for joining us.
And our fellow Americans who want these products. We're working for all of you.